Don't you think it's
That seems reasonable.
all right? So this is a drive run. I'm Rob. This is Sean, and this is a dry run approach at possibly starting a podcast. And I think it's going to be a conversation about what would you call it? Spatial medicine, like the approach toward mind-body connectedness.
I think that's right.
Yeah.
I think we've identified essentially, or at least like to think that we've identified kind of a space that exists between two disciplines that could potentially use more conversations being had within it. Just in general. So if we're going to move in the direction that we think that our culture should move, then we need to have more conversations. And this would just be an example of having one of those conversations.
Yep.
And the two spaces, which you identified the other day, which I agree with, is like kind of the physical space, which is like the space of trainers and bodywork people and chiropractors,
Physical therapists. Yeah.
You could put a lot of medical doctors into that category.
Yeah. Mm-hmm.
And then the space of
psychology, psychotherapists, psychiatry. Yes, that's
mental health, counseling. Counseling.
Yep, exactly.
Yeah, and then maybe you could even put into like a third category might be something like the spiritual realm, right?
Yeah.
Which might be like more religious fields, like
that's
monks,
more like philosophy. Yeah. And I don't know. I mean, that certainly plays a role in like how it shapes society and culture and like indoctrinations and beliefs. But I think for now it's like it's the two realms. It's like we basically have like the rehab world of like trying to make people's bodies perform better to overcome injuries and traumas, and then we have this mental world which is like helping people overcome their emotional hurdles, their traumas in life. So I think one of the reasons we've decided to start having these conversations is it seems a lot of people are kind of dividing the two and separating them. Someone's trying to improve the way they inhabit their body or the way they express themselves in their body, and they're going to kind of just one of the realms. They're going to either personal training or they're going to yoga, or if they have an injury, they go to physical therapy. And then on the other side of things, they might be trying to overcome something emotionally or behaviorally or psychologically, and they're just only going to, mental health counseling. So we've kind of identified, I mean, not just us, there are lots of people who have identified the need to discuss, there's a middle ground. There's another way of kind of connecting the two to overcome any obstacles that you might be experiencing in your life. That kind of...
Yeah. If you, at least from my experience, and I think it's many other people's experience, if you aren't gonna try to deal with both the mind and the body as kind of a single entity, then you're gonna be missing some of the essence of what it is like to be kind of a human being.
Yeah.
It's like when you disconnect the mind and you put the mind in a jar and then you try to have a conversation just with that, I think there's a certain amount of like progress that you can make, and progress exists in certain forms of therapy that are effective, but you're also going to be missing the fact that mind developed along with its body. So like, it was wired in as the body, when you were a child, learned how to establish itself against gravity. So at one point, a child's lying on the ground, and then it's going to work towards getting to standing. And as it patterns itself to learn how to build a nervous system to get to standing, at the same time, its mind is being developed.
And shaped as well.
Shaped, right?
Yeah.
And then out of the physical body emerges like this subject.
Yeah.
It's like this baby.
Yeah.
Which seems like kind of just a roly-poly object. Yeah. All of a sudden starts to like play back at you and like be a person.
Yeah.
And it's like
It moves in new ways. It takes the environment in. It gives feedback back to the environment, back to the parents or the siblings. So all of a sudden, it's like Sean said, we were this roly-poly baby on the ground, but as soon as we're upright, it's like the mind and body is constantly building itself. And it's basing each action and decision it makes is based on a preceding event or experience.
Sure.
And like, hey, how was that experience? It was a good experience. I want to do it again. Or it wasn't such a good experience. I don't want to do it again. Or maybe it wasn't a good experience, so I'm going to approach it differently this time. So that shapes my behavior towards the external world, and therefore I start to move my body differently.
For sure. And there's like ways that you can move your body when you're growing up that are going to be perceived by the environment as being like something that you shouldn't do.
Yeah.
And like I love to go back to this analogy, and I think it's a good one. And so we're talking about the capacity to move your hip and to access your hip and to move your pelvis around your femur and to move your spine is when you grow up in particular cultures, certain types of movement around this area and around this area can be perceived socially as like being associated with a certain gender.
Yeah.
So like if you move your spine in waves and you like shake your ass and you like kind of like do these things that are like often associated with dancing.
Yeah.
It's like you're expressing a feminine thing.
Yeah.
And like because that's the case when I'll speak from my perspective because I'm a male, but when I grow up and I'm living in Massachusetts and I'm looking out into the world through my two eyes and I see men expressing themselves, I don't see any of them expressing themselves with certain types of hip movement.
Yeah, so and especially like we're in New England, so it's kind of like Puritan country, like the men up here, like they're not taking their pelvis and they're not, we were talking about this earlier, they're not abducting, adducting, they're not rotating their pelvis, they're not really being too rhythmic with their hips. And it's because of a cultural indoctrination or a cultural belief that like that's a feminine thing to do. It's associated with dancing.
It's free.
It's free.
Yeah,
it's expressive. It's colorful. Yeah, it's
Yeah.
all these like really beautiful things. But then because of what society kind of wires into us at a young age, is like if you're a guy, you don't do that. Okay. And therefore, I mean, getting back to like movement, because like Sean and I are both trainers and body workers in this area, is like over the course of a lifetime, 5 years, 10 years, 20 years, if this is your mentality and you're kind of fixed in this perception of the world that moving your pelvis in a rhythmic way is feminine, and then whatever associations you have to that femininity, it's like you start to really fixate your hip. You start to fixate your pelvis, which, over the course of these other conversations we have, we'll talk about how if your pelvis is fixed, your low back could be stuck. It could prevent your rib cage from being able to shift or rotate, or it could affect the way that your pelvic diaphragm interacts with your respiratory diaphragm. Okay, so it starts to just lead to this kind of slippery slope of, okay, it was one thing, it was one belief system for a long time, but now I'm 40 years old, I've never moved my pelvis in a liberating way. Mm-hmm. I don't even know how to. So anyways, that's going to be a problem in the next 10, 20, the next decade of my life. If I continue down this path, it's probably going to start to get pretty problematic.
Sure. It's, I think it's a hard connection to make, but I think that it's not completely far-fetched. Like, if you have a social understanding or a psychological understanding of how you're supposed to move, like, men move your hips this way, then I'm going to keep the variety of hip movement within a certain domain, right? Mm-hmm. And, like, the way that our bodies work is that we're going to send, we're going to lay down tissue in the direction of the movements that we're making. So the fascial lines are gonna form around the domain in which we move. Yeah. Right? So like even though it seems very psychological and mind oriented, it's getting layered into a physical form.
Yeah.
So then when you eventually say, oh, maybe I'd like to try to move my hip differently, it's going to be very challenging because all the tissue got laid down to prevent you from moving that way. So now you have a physical manifestation of like what we think would be kind of like a psychological coping mechanism.
Exactly. Yeah. So anyways, like this is an example of how, you know, we're having these conversations about people are trying to overcome things mentally over here and then physically over here, the brain in the jar, the body in a box. But it seems like the average person, although is really interested in like improving and evolving and bettering themselves and putting in the time, society has divided these things and put them in separate rooms. And what we're trying to do with our clients and have conversations about is like, how can we bridge the gap a little bit so that the body and brain are kind of developing together and we're starting to understand our behaviors and being able to relate them to limitations or restrictions we have in our bodies, or vice versa. You know, maybe you have a mental hurdle or something, some sort of like trapped, not energy, but emotion, you know, like a psychological barrier, something you can't get past. And could it correlate to your shoulder? Could it correlate to your hip and the little movement options that it has, or you talk about restoring options back into the body.
Sure.
Like we're born with certain joint functions and ranges of motion in our body, but as we get older, we start to lose those possibilities, right? And so how can we restore them and kind of put them back on the menu so that then we have them to use and to access? And typically, if we can access more of ourself, we can use more of ourself, and we start to understand the complexity of the human self. Okay, so anyways, that's just like another thing. Yeah, it's like I think a lot of people are living in pain, whether it's mentally or physically, and a lot of times it's because they're approaching things in a very like black and white manner. Mm-hmm. But if we can help start conversations and get people to maybe change their perspective a little bit about like, oh, I'm only taking an approach like this. Maybe I need to try and like shift my paradigm, put it on its head, and take this approach instead. And I think when we start, the more information we can have about our body and our mind, we can actually start to understand our pains and discomforts and our stagnations in personal growth. So I think that has a lot to do with it. It's like giving the power back to people, giving the power back to clients and individuals by educating them. Okay, and not just saying, hey, you have to sit in a room and talk about your problems, or you don't have to just go over here and exercise and do fitness to make yourself feel better. It's like, let's really talk about the particulars of your body, your experiences, your anatomy, and see if we can, and give you that information so you get the power and you get to kind of heal yourself. Like the healing process starts on its own.
Mm-hmm. There is, I think it's also, we want to be careful and like use the right tone and the right language around kind of maybe approaching some of these ideas, because it could be very easily perceived as we want to change the system, or we want to uproot the existing system, like there's something wrong with the system that exists right now. And it's like, it's not like there's something wrong with the fact that psychology and body-oriented practices kind of split. I think that to a certain degree, like to understand them as separate entities, you kind of need specialization, and you need people that are willing to just like put all their energy into one thing and then put all their energy into the other thing.
Yep.
But when you split things apart, you're also going to lose some of the like interconnectedness, and it's there's not, I don't think there's necessarily I don't think it's like we want to change anything so much as like honor the actual truth that exists within each of them,
Yeah.
and like maybe find some of like the transcendent principles that exist between
Yeah.
body practice and mind practice.
Yeah, like similar veins of interest. I totally agree. Like, yeah, we're not trying to say this is not good, this is ineffective. Like, we want to respect these different systems and the principles that they have built themselves on, but then just see if there's a similar thread of continuity, and like where are the overlapping layers, and how can we maximize or leverage ourselves in the most efficient way, optimal way possible off of those layers. So yeah, I would say that this is why we're starting the podcast, is to start these conversations and see if people are interested in listening.
It does. It can get like it can get really confusing, I think.
Yeah, it can
like,
get confusing fast.
And that's so we'll try to do our best to
not let that happen.
Be as simple and straightforward and like open about the ideas as we can.
Yeah.
And we're open to plenty of feedback. And I think actually part of it that I was telling Rob about this before was like I think about these ideas a lot.
Yeah.
And I don't know how real or true they are because I'm not putting them into the environment enough to get like people to either be responsive to it or like to say, you don't know what you're talking about.
Yeah.
This is why, or I feel the same way as you.
Mm-hmm.
So this is a way of maybe putting some stuff out there so there can be feedback given on the ideas instead of it just being inside of my own head.
Yeah.
Because some of these ideas I think are probably not that easily addressed in maybe the environment that we work in all the time, like in a group setting or like people want to get their money's worth, so we're going to be giving them the stuff that they have to do, and there might not be as much time for like talking about philosophy and theory as much as like when we're working with people, we're practicing.
Yeah, that's right.
It's
yeah.
Like, trying to give people their money's worth.
Exactly, yeah. Like during a session, somebody comes in, we're not going to be having these longer, in-depth conversations about like why their shoulder hurts. Like somebody shows up and they're having a shoulder impingement issue, or maybe they want to get better at running or lose weight. Whatever their reason for coming into that session. Like that's why we've got to prioritize that. That's the goal. Either to get them out of pain, give them the result. But we don't necessarily have time for some of these deeper conversations about, I think a lot of it is physiology too. I mean, it's behavior, it's psychological work, but it's like human physiology. I mean, sometimes things are simplified and cut and dry, like, bicep goes from like, the acromion to like the forearm.
Yeah.
And it's like, well, we don't always have times to start having conversations about longer kinetic chains, how they relate to, maybe the thoracic spine or the cervical spine or neural conductivity. Like this is where this space is going to be useful for us because we're going to be able to extend our messages to people who are interested.
Sure.
So maybe that, again, I go back to empowering the client because my own experience with a lot of like some of these separate principles or separate methods of like overcoming like traumas and injuries and stagnations in my growth is I sometimes some practices gave me power, but oftentimes I felt disempowered as the client, and a lot of it was just a lack of information. Like I wasn't being told enough about, like when I had my 3 bulging discs in my neck. First, it was like chiropractor, physical therapy. I did that for a while. And then the next solution was like, well, we could give you a discectomy. So we can go into your neck, shave off some of the disc that's pressing on the nerve. And for me, like, that wasn't an okay third solution. I felt really disempowered. Like it's my neck, it's my experience, my story, how I got injured. Why do you want to take that away from me? So I'm hoping that if we can have these sorts of conversations and maybe help broaden people's perspectives or understanding by giving them the tools to understand themselves, it might help them out.
Yeah, there's value in, I think, understanding what you're doing from kind of an intellectual level, and then there's value from an experiential or a practical level. And if you can knit the two together, it's more valuable because, for one, you could probably share the information more.
Yeah.
But like just from a maybe even like a spiritual level, it's helpful to feel it, and then also like be able to explain what it is that you're feeling.
Yeah.
I think another component that we were talking about a little bit before, and is true, is I'll go to a class, right, and I'll choose things to do with people, whether it's what we're going to do for the warm-up or what we're going to do for like the main bulk of the workout. And all of that is being informed by all the other things that I'm thinking about, like on like maybe like more of a theoretical level. So like I'm thinking about these ideas, and like I'm trying to figure out what should I do with the people in class today, and the ideas are going to inform what I'm going to do in class. So this might be more an example of like speaking the ideas out loud that are going to inform what is going to be done in class. And a lot of the times, I think what it falls back on, and I think this might be true with any discipline, is always trying to boil it down to like the most basic stuff. Like, you want to have good foundations and you want to have good basics. And if you can build the foundations and the basics, I don't know as much what that looks like in psychology because I'm not a psychologist. I would imagine it goes into looking at like where you came from and your story,
I have
your background.
I have a feeling it's simple though, you know, like the basics are still simple, whatever discipline you're in.
Yeah, exactly. And it like, but at the same time, the basics, it can be really easy to get caught up in the flash and the glamour of like double dumbbell power snatches and things that like look really cool, but if you don't have the basic ability to do maybe like a plank or like a dead bug or like maybe even just to move your diaphragm
or rock your pelvis, anterior, posterior, tilt your pelvis.
It's like let's go to look at some of the most simple things, and then once we're pretty good at the simple things, we can do some of the other stuff. And like maybe that, I don't know, maybe it has to do with psychology as well. Like there's kind of like basic psychological needs and things that we need fulfilled. Let's work on those fundamentals, and like we'll take it from there. I thought it was really cool, like just listening to some of Jordan Peterson's work, where he was talking about how he was on these medications and he was trying to deal with some of his pain and discomfort in his body, and then he changed his diet to like a carnivorous diet, which is an extreme diet to go on to, where you're eating only meat, and all of a sudden, like a lot of these psychological and body issues started to clear up. So it's like he was trying all these strategies, but then it's like if you just change your diet, then a lot of things will fall
into place. So
it's like, was it a psychological intervention?
Chicken or the egg?
Yeah, or was it just a physiological, nutritional intervention to produce a psychological result or a physical result? So, it's...
what's interesting about that one thing is I remember hearing something about his diet elsewhere, and like before that he was doing like white bread, like peanut butter and jelly sandwiches and a lot of dairy. I don't know if you heard that too, but like he was doing, like he said he ate a lot of PB&J with his like white bread, and then he switched to like more of a carnivorous diet. And so anyway, I just thought that was funny.
It's like, I think it's funny that like
it can make a difference though. Like
it makes a big. It's like, why are we maybe thinking about major interventions when it could be something that's very basic? Like really just basic. Put good food into your body and like treat your gastrointestinal system well. Like be gentle to your gastrointestinal system. Maybe like go to bed on time and wake up on time. And like maybe
it can be a lot simpler than having 4 different therapists you go see and stressing out about what you're doing wrong when really so much of everything in your body and what's happening right now is already like functioning really, really well. I think sometimes we're inclined as humans, especially in the 21st century with all the social media and the pressures and imagery and like social pressures, it's like we really like to focus on what's wrong instead of sometimes just being humbled by everything that is right. So, I'll think about my back. I think about my rotation of my pelvis. I think about my neck pain, my jaw pain. And then we focus on them, and they start to paint their own story. And we forget about this wondrous thing that is like the human nervous system and how well it's functioning day to day. And like you so accurately said, like maybe I need to stop trying to exercise my problems away. Maybe I need to employ some deep breathing every day, and call it meditation or just call it deep breathing, call it diaphragm breathing, whatever you want to do. Getting sunlight, like sunlight is really important in the 21st century. We're surrounded by artificial light all day long. People have chronic like stress, inflammation. They can't sleep. They're not producing enough melatonin. So now they have hormonal imbalances. And you ask them, when was the last time you were in the sun? And they talk about like when they went to the beach 3 months ago on vacation. And it's like, hey, the sun's out every day. You just got to prioritize time to stand in it. And I don't care if it's the dead of winter. I go outside every day and I just stand for 10, 20 minutes in the sun. So anyways, it just goes into this idea like there could be so many different facets to improving the state of our being and of ourself, and it's not so cut and dry. Although I guess we're going to try and keep it somewhat simple and cut and dry.
Yeah, I think that's what we'll try to do, and
right, yeah,
we'll do our best. Before I was here, I was listening to an interview with Andrew Weil, who is a well-known integrative medicine practitioner. And he was talking about the effectiveness of like really gentle interventions, like a breathing practice in your life. And it's like he was making a good point about how some of the conventional evidence-based community might get somewhat critical of like some of the alternative ways of treating. But an interesting thing to keep in mind is like, you're not going to injure yourself by like introducing a breathing practice into your life.
Yeah.
And the effect that you might get from having a breathing practice could be equal to, greater than, of course, less than some of the other means that you might be using to try to deal with things like anxiety or deal with things like stress. And introducing something that could be really simple that you just aren't paying attention to could have a big return, and there's really no risk at all associated with it.
Yeah, exactly. It's so true if you think about it. Like, if it doesn't feel good, you don't have to do it. But the possibilities, the options, the choices are endless. Like, there are so many different ways to go about feeling better and feeling good and trying to feel healthy. I think that's what most people want. That was one of the reasons I wanted to start this podcast, was like people are obsessed with, I don't even know, fitness and exercise and being in shape and being really smart. And it's like, what about healthy? Like, can't we just be a kind of a balance of everything? Like I can be kind of smart in some areas. I can feel good in my body. I can be somebody who can like express emotions and receive emotions like somewhat well, and I have barriers in my life. I have demons. Like, can't we all just kind of stop searching for highs and lows and just try to meet somewhere in the middle? Like if it feels good, do it. If it doesn't feel good, seek out some other complementary solution toward improving the way you feel.
Sure.
And on that note, I was going to say all this stuff I think that we're going to talk about is also probably awareness, right? Like this is just awareness work.
That's like, I think probably if we were to boil it down to like anything, it's essentially going to come down to like bringing awareness to our body, bringing awareness to our behaviors, our history, our culture, awareness
habits.
to habits.
Habits are big.
The things that are going into our body, the things that we're saying, our language, I think is a big one.
The language we use to other people, but also the language we use internally to ourselves, like how we talk to ourselves.
Yeah.
How we respect or don't respect ourselves.
How we can like tinker with maybe some of the words that we use to start to create a different reality that we live in, and to express ourselves in a different way.
Yeah.
And then language might mean more than just verbal language. We might be talking about nonverbal language and movement language and
Body language,
etc. Just language as a concept, I think, will be probably pretty consistent.
Yeah.
But yeah, awareness, that seems about right.
Yeah. So I think we could probably wrap it up there. I mean, that's good. Like if we end on awareness.
Yep.
This was a pretty big mouthful, but this is what we decided we had to do, is like give out a first attempt dry run. That's what we called it, right?
Get something on the board, right?
On the board, yeah.
On the board.
Yeah, so we're going to post this online, and again, we're welcome to feedback, what you liked, what you didn't like, what if you have questions, what you'd like to hear us talk about. I think that would be cool. Like you as the listener, it's important that we're addressing things that you're interested in. And I don't know, anything else?
I think that just about covers it. Yeah. Any feedback is helpful, and yeah, see you next time.
See you next time. All right, thanks.